Welcome and thank you for tuning into A Sound Constitution on CHLY 101.7 FM with Cassandra, Harris, Carla, Kelly, Max, and Samantha. We're third-year BSN students at Vancouver Island University in Nanaimo. We're working to demystify healthcare issues affecting our community, bringing you evidence-based information about our healthcare. This information is for education purposes only and does not replace the advice of your primary healthcare provider.
We would like to start our show by acknowledging that we are on the unceded territory of the Nanaimo people, with a broadcasting range that overlaps the Kuwatsan and the Sliaman territories. This acknowledgement is done with gratitude to the Nanaimo people and with the intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding Nanaimo history, reconciliation, protocol, and land acknowledgement can be found on our Facebook and YouTube pages.
Thank you for joining us for today's episode of A Sound Constitution. My name is Max. I'll be your host today, along with my co-host Kelly, as we dive into the phenomenon of COVID fatigue. What do I mean by that? I'm talking about the indirect consequences of the pandemic on the health of people as individuals and as members of their respective communities. I'm not talking about positive tests, viral infections, signs, or symptoms. By COVID fatigue, I mean the exhaustion, uncertainty, fear, despair, suspicion, and stress we're all feeling to various degrees. Our province is now well into the second year of something that most people initially believed was only going to last 2 weeks. The provincial government of British Columbia has, as of March 30th, extended the provincial state of emergency 26 times since the initial declaration. Provincial health orders and economic restrictions have been ever-changing, and it has been a very challenging task to stay current on what businesses and individuals are permitted to do. People are living in a state of perpetual confusion which can apparently be extended indefinitely. We miss our old normal. We do our best to seek out credible information to keep ourselves and our communities safe, but it can often feel as if we are running a marathon where the finish line is constantly being moved, and it's wearing us out. The World Health Organization defines health as a complete state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. It can feel these days as if the singular focus on preventing disease has perhaps overshadowed the rest of the bigger picture. Living under the cloud of COVID-19 for the past year has taken a tremendous toll on the health of the population. The confusion, the hostility, the isolation, the lack of socialization, the politics, the profiteering, the social engineering. Our collective mental health is being tested on a daily basis. Our social well-being is tenuous at best. Fear, confusion, misinformation, and disinformation have people's hackles up and their spirits down. That is what I mean by COVID fatigue. The symptoms of the virus are one thing, but today we are going to talk about the symptoms of the pandemic and our societal reaction to it. We'll discuss coping strategies and supports among different segments of our population, examine ways to build up resilience, and look at how we can help each other stay safe, stay sane, and keep putting one foot in front of the other. For the first half of our show, we're going to cut to a recent conversation I had with one of our Vancouver Island University nursing program faculty members, Tina Pereza-Rolls. Tina was kind enough to meet with me over Zoom and share her thoughts on the effects of a prolonged pandemic. I'm joined now by Tina Pereza-Rolls. Tina is a theory and practice instructor in the Bachelor of Science in Nursing program at VIU and a practicing RN with Island Health. Tina, thank you very much for joining us today.
Thank you so much for having me.
Could you tell us a bit about yourself and your background?
Yes. I have been a registered nurse now for going on my 24th year. all within Island Health. I've worked at West Coast General Hospital and NRGH. And for a bit of fun there, I also was a nurse at a children diabetes camp on the Sunshine Coast, which I really enjoyed and got to learn a lot about collaboration and teamwork in a very non-traditional but oh so fun setting. I have been teaching with VIU now for 18 years, and I absolutely feel so fortunate and love what I do. I am so inspired by all of you and the work that you do, that you as my students gives me hope in nursing and for the future. And I thank you for that.
You're too kind. I would like to ask you, as a practicing RN, what has life been like in the acute and critical care areas over the course of the last year? Could you give us a bit of a peek behind the curtain as someone who is very active in acute care?
Yes, yeah, it's been pretty stressful, actually, to say the least, and especially being working in the healthcare field in general and in the hospital, as stressful as it is. But this has added a whole other level. So especially at the beginning. So looking upon reflection in a year ago, there was so much uncertainty and fear and not known. And just because this was so new and so novel, the novel coronavirus, this was something that none of us have ever experienced before. We did not have a dry run of this. There was no opportunity to see what this was like before, to span from, at least within our area where we are in this part of the world. They've had endemics and elsewhere, but for us, it was quite new here. So there's a lot of stress just in terms of a lot of fear for how is this going to affect my health? How is this going to affect the health of my family? Do I have this virus? What do I do about it? What does isolation look like? What does lack of proper PPE look like? Because that was never before a concern. We've had the PPE that we needed. So suddenly we didn't have those very safeguards in place to protect us in our workplace. And at the same time, continuing to provide the excellent care and that's needed for the people in the hospital and making sure that they were safe. So it was a lot of unknown, a lot of fear, a lot of uncertainty. Information was changing weekly, and at some points daily, and it's trying to streamline who was communicating what the resources and what the source of information was coming from. But a year later, there is more comfort in terms of just going step by step, using the information that we have been getting from public health, from the Center for Disease Control, looking what's happened nationwide as well. We're very fortunate on the West Coast because you could see what was happening through the eastern part of our country. And then you can almost see in terms of the wave and begin to have some of that preparedness, or at least anticipation of it.
Just like time zones, like you're
yes.
a little ways ahead of us, so we can brace ourselves.
Yeah, so we had that grace period in order to exactly, and then looking in Europe and looking what was happening in Asia, just waiting to see the trajectory potentially, and then utilizing that to our fullest as much as we can, at least to prepare ourselves, because nursing is always about anticipating. It's always working in the moment, but it's also being prepared for the future as much as you can in such an unpredictable environment at the best of times. And then you superimpose it with the pandemic, and it's just that much more unsettling and ungrounding.
I'd like to ask you, what type of support do you still see being needed for frontline nurses and healthcare workers?
That's a really good question because, well, first of all, that there is more support needed. That it's not that we can always need more support. And I think the big thing is for nurses to really be heard and listened to. So we know nursing. Nurses know nursing. We know we've studied this. We've practiced this. We've learned this. We apply it on a daily, hourly basis. And so really listen to the staff and know that it's for, honestly, the betterment of everyone, because at any given point, we could be that person at the bedside.
Absolutely, I agree. Best support you can give someone is to listen to them when they are trying to tell you something.
Yeah. And that's exactly what we do at the bedside too when we listen to our patients, is just to really carve out that time and the space and to be present and hear what they're saying and really truly listen, uninterrupted by the outside, but uninterrupted by our own thoughts already coming to a response for them. So again, I think as nurses, we want to have that reciprocated for us to be listened to and heard what our concerns are, because we're also problem solvers. We're also decision makers. So we know what is needed to help us provide the care that's required. And that's been happening more. I think that has finally come into the fore in terms of listening to the concerns and trying to come up with solutions for that.
Challenging hegemony, am I right?
Yes.
I'd like to ask you, how has your nursing teaching been affected in both the clinical and classroom settings, and how are students and faculty holding up a year into this thing?
That's a really thoughtful question there, Max. For my teaching, it's been one, certainly, of trying to be more adaptive and flexible. So, for example, in the theory classes, we're able to transition more online. But just like nursing is live, I like that live in the classroom setting, just to see people's reactions, to see their pauses, to see their ponderment. And you don't get that on screen. It's so one-dimensional. It's been very different for me, because just like in nursing, how there's a relational aspect to that, I'm really missing that interaction with my students. Because to me, it's a give and take. Like it's a teaching and learning when you reciprocate to each other. So I'm really missing that, because to me, that fosters and feeds me, and that helps me be responsive to that. So it's been a lot more adaptable. I think I've been a lot more flexible, just really listening and giving the students a space to articulate what their concerns are, again, because school is but one aspect of their life. And as important as that is, and I think especially now, you all always want to do an incredible job as students. And then to be entering a profession that every single time matters and that it counts, just adds to the extra meaning and significance and stress of it all. And so it's in making learning safe. It's in making you all have the opportunity to express what your concerns are, what your thoughts are, because hopefully that will be reflective in the reality of your practice as well. In terms of as a faculty, we have come together and communicated like we always have, but even that much more so, in terms of what do we need to do to help support our students and to try to make their learning maintaining the rigor that's required and the standard that's required for entry into practice. So then that way you are able to receive the education that you have been in order to enter the reality of practice.
I agree with a lot of the points you're making. Personally, from my perspective, I think VIU and all of the faculty have not only been flexible, but have bent over backwards to try to accommodate everyone's wishes and desires and pet peeves. I personally am appreciative of the fact that they have done as much as they have done simply to keep us moving forward through our various programs, rather than saying school's closed, try again in a year, you'll just have to graduate another year later. Honestly, I have found it to be better than it probably has any right to be as far as what I've learned over the last year in school. You think just sitting in Zoom meetings all day, you're not going to get anything out of it, but I've been surprised.
Excellent.
All have done a fantastic job, and I don't know if that has been mentioned to you enough.
Thank you. That's wonderful to hear. And that's again, we are preparing future colleagues, and so we want you to feel supported. We want you to be able to feel that you're engaged and part of the learning. And it's been a lot of work, and honestly, learning to nurse is challenging enough. Learning to nurse during a pandemic is that much more. The resilience and the skills that you will have now, and it's not when you're in it that you notice it, but like later on, when we begin to get back to a sense of what was once. And it'll look different, but it will resemble a little bit more a time before than this state of unknown and fear. You will all look at yourselves and think, I can't believe I did that. That will be such a strength for you. And that skill will honestly serve you so well in whatever area, personally and professionally, that you do. And I honestly and wholeheartedly believe that. And especially to learn during the year of the nurse and midwife.
Are you optimistic about potentially returning to campus in the fall? Do you have any guesses as to what that might look like?
I'm optimistic, absolutely. And we have to do that again cautiously and carefully, just to make sure that we have as much of the safety measures in place as deemed by the public health order. And just like with anything, you just have to make sure about your environment and that it's safe to be in that space again. But I'm very hopeful and I'm actually really excited. And it's going to be quite an emotional time just to see people again, just to see their expressions, and that presence will be, I think, very touching and unifying in a way that hasn't been for a long time. I'm missing seeing you all of you.
I miss it too, more than I was really willing to admit for a long time. Several months in, it was like,
Yes.
I'm starting to miss human contact to some degree.
Absolutely. Yep.
I know it's been stressful for instructors at VIU and for frontline healthcare workers. I'd like to ask, how do you personally keep from burning out? What are your self-care tips?
Go outside. I love to be outside. I need to be outside. Where we live is so fortunate that we have nature around us, from the mountains to the water. So I go play outside. I love to go for hikes, bike riding with my family. I'm missing seeing my friends and being part of that interaction, because it's such a beautiful time to have that shared experience and to create that. So I'm missing enjoying that with my friends, but I feel very fortunate to be able to do that with my family. I also like to spin. I've been doing an online spin class and absolutely love that. And it's the same group of people who've been there, and we truly look forward to that. And for me, it's been really important to take care of my physical health, to take care of my mental health. It's actually a mental health outlet for me. I feel very fortunate that I have found something that feeds me and fosters me and keeps me healthy, as well as listening to music. I will listen to everything and anything, and I am missing my concerts. A personal thing. I love concerts. I love that shared moment with perfect strangers, just singing off key and making it sound good because the band is playing. I miss that camaraderie, and I'm looking forward to doing that again. But I still have my own little sessions in the car, in the house, listening to music and enjoying myself with that.
I'm with you 100% on that one. I personally don't want to live in a world where concerts are a thing of the past. That is like one of the top things I miss. I can live without a lot of the things that have been shut down, just speaking for myself personally, but I really miss death metal shows in some cramped, sweaty, stinky club, just deafening volume. And
yep.
I'm glad I went to as many as I did before this came along.
Well, and I think that's the thing. I'm glad that I bought those tickets. I'm glad that I've done those things, because you honestly, you never know. And no one could have predicted this in terms of being the extent to what it was. And so my thing is like, why wait? If you have the opportunity to embrace it, to do it now, and just because you never know when this opportunity is going to be presented again. And that's to have that spontaneity is I'm missing that. And to have that other option of play, I'm really missing that. And I think a lot of us are, but just to do things while you can, because you never know what circumstances can say you can no longer do that, either with your own personal health or what's happening worldwide health-wise.
You don't know what you got till it's gone.
Yeah, exactly.
Has the response to COVID-19 identified any gaps or areas for improvement in our healthcare system? Alternatively, are there any areas where you think we've really shone and met the challenge?
That's a really good, hard question, because I'm not an infectious disease practitioner or know much about health to analyze the healthcare system within that area of expertise, only myself as a practitioner. So I think in terms of what's come to the fore is communication and streamlining of communication, where the communication is coming from and how to impart that in a timely manner, and finding out what is the most truth in the moment, because it's always evolving. The information is always changing. And so trying to keep current with that has been very challenging. And I think the modes of communication in terms of how to streamline that, I think it's getting better in terms of having town hall meetings and the opportunity to engage in these discussions. has been helpful, and to have more of that. Probably another gap is, again, what's happened across Canada. I don't know so much here, but what's happened in long-term care and complex care settings with older adults. That is a population that we must look after carefully. And so I'm pleased that they are the first group to be receiving immunization as a priority. Improvements would be really mental health is that much more being spoken about and acknowledged and recognized, and hopefully being discussed about and promoted that much more. Mental health affects all aspects of our lives. It affects every single one of us. And I think at this point during the pandemic, it has affected everyone's mental health in a way that they didn't realize that it would before, or didn't realize that that was even a part of their health to be concerned about. So in terms of mental health resources for short term, but also long term, and especially with children and looking how they have been affected in terms of socialization, in terms of their own safety, because this is their normal. They won't know any different, some of them, and yet looking after them. And we don't know yet necessarily, or I don't know yet, the long-term complications of that.
The socialization of kids in their formative years is something that, I mean, it doesn't get much more upstream than that.
Yeah.
You know, I worry a bit about how these kids are going to grow up and turn out if this goes on forever, or just simply if they spend those first 2, 3, 4 years, you know, basically terrified of other people rather than learning to play and interact. Well, what you said about mental health, I think, is huge. In the introduction to this episode, I've spoken a bit about the World Health Organization definition of health is not merely the absence of disease, but a holistic, complete state of physical, mental, and emotional well-being. It sometimes feels like we've got tunnel vision on ensuring the absence of disease at the expense of perhaps other aspects of what constitutes health. And I really think we need to broaden the viewpoint, especially a year in now when we know more than we did when this was first unfolding.
Absolutely.
The mental health aspects are something that's going to affect everyone.
Those are just huge considerations, and we need to just look out for each other and to be aware of that. And so I can see a huge public health initiative on that. So hopefully that will be the good that comes out.
Speaking about community health and the population as a whole, have you noticed a more proactive or preventative shift towards health and wellness among the public? And I'm not specifically speaking of just masks and social distancing and the other provincial health orders. Have you noticed people making lifestyle changes, incorporating more diet and exercise considerations into their lives? Would you say we are starting to think more upstream about our health? Is it sinking in?
I mean, I hope so. It's, if anything, is given the opportunity for thought of it, because it's the everydayness that we just do everyday things. It's the taken for grantedness of it all. So I'm hoping that it has given just a pause for thought in terms of, in addition to the hand washing, in addition to the masking, what else am I doing to keep myself healthy? So what type of food am I putting into my mouth? What type of exercise am I getting? Both physically and mentally. How am I keeping in contact with people? That would be the ultimate, wouldn't it? Like in terms of time to pause and reflect and see how this has affected our health in an everyday way. That's a really hard question. That's a research question there, Max. Like as an aside, like that's excellent. Yeah.
Well, thank you.
That's a hard one.
Yeah, there's no blanket answer for it either.
There isn't. And the big thing is just to be non-judgmental. That honestly, I think that people are trying the best they can with where they're at, with what they've got, and to really be non-judgmental and to support each other and to question in terms of what are the barriers for people not being able to be healthy? Why are groceries so expensive? Why is it so hard to get the resources that are out there? How do we even come to know what's available out in the community? So it's things like that, just looking at access and what is accessible to whom and how and why not to others. The determinants of health are a very real thing. And for us, it's because you have been taught from this at a year one level that coming now, you can actually see how it happens. You can actually see how it comes into play. You can see the reality of that.
Absolutely. Thinking long term, how do you see the events of the last year affecting the work of nurses in the future?
I think we're very fortunate because nursing has been one of the most trusted and respected professions, and that I think nurses will continue to remain that way, that health is always at the fore. Again, to listen to the nurses and to know what we need in order to provide the care that you need.
Tina, that just about covers everything I had hoped to ask you today. I really want to thank you on behalf of the A Sound Constitution team. Before we end it, is there anything you'd care to add or anything you'd like to say to the community at large?
Please continue to do what you're doing and follow the public health guidelines. There's a lot of thought that goes into it. We are truly in this together, as Dr. Bonnie Henry would say, and that I am so incredibly proud and hopeful, and the work that you are all doing as nursing students and disseminating and imparting this information. The work that you are doing is important, and it matters, and it counts now. And I am very proud that you've chosen to enter the nursing profession because you are exactly who we need.
Tina, thank you for your time, and thank you for joining us.
Thank you very much.
You're listening to A Sound Constitution on CHLY 101.7 FM from Nanaimo, and we are talking about COVID fatigue. My name is Max, and I'm joined now by my co-host Kelly and our research assistant Sam. I'd like to start this discussion off by paraphrasing an article from the Philadelphia Inquirer dated March 25th titled Pandemic Exhaustion, which I think might get our talk rolling. We are all mentally, physically, and emotionally over this. The exhaustion is real, and so is the fatigue. We are all so tired, but we have no choice. We have to keep on going. We are even more bored. We are busier, and we are completely zoomed out. We want to know what's going to happen next, but at the same time, we are doing the same thing over and over and over again. That in itself is exhausting. We aren't just over it, we are also more tired physically as we cram more tasks into days that feel longer yet fly by. Our eating habits are off, our sleeping habits are off, and as we collectively fight the urge to doze, we lost an hour of sleep thanks to daylight savings time. Let me ask the two of you, does that about sum it up? Does that feel relatable?
100%. It sounds exactly right.
Yeah.
Definitely.
I agree. We have recently crossed the 1-year anniversary since COVID-19 was declared a global pandemic. And we try to stay in the loop. We're constantly watching the news. What's next? What should we do? What should we be doing? What should we not be doing? What should we avoid? And it feels like the rules are constantly changing. The goalposts are constantly moving. And eventually you kind of get tired of watching the news, and that can be dangerous because if you start to slip in a situation like this, it can be potentially catastrophic, right? We've all heard the modeling data, and we're all doing our best to follow provincial health orders and guidelines from the experts, but it can be draining on a person. I think we're all at a point 1 year in now where we just want things to go back to normal. I'm hearing that a lot more in the last few months as the vaccinations have started to roll out. Everybody just get your vaccine so we can go back to normal. But I also hear a lot of hesitancy out there that things will ever go back to normal, that this is the way it is now, the new normal. You know, that was the phrase of 2020, I think. I'd like to ask, I'll start with you first, Kelly. How has the response to COVID-19 changed our healthcare system and our day-to-day lives? And has it identified any real weaknesses or opportunities for change that you've noticed?
Thank you, Max. I think in terms of day-to-day lives, what I've noticed is a lot of things can actually be done online. Things like visiting museums, having different meetings, art classes. But I think at the same time, one of the weaknesses that we've discovered is how fragile connections between humans can be. I feel like throughout the pandemic, because a lot of my social interactions had been moved to online,
somehow feel like I'm actually losing friends. I'm being shut away from their lives, what's happening, what's going on. I feel like I'm becoming less aware of those. In terms of healthcare system, I think we can now realize that things like compassion fatigue and burnout are becoming more and more prevalent as COVID is continuing. It almost feel like you're coming down a roller coaster or jumping out of an airplane. You just don't know when you're going to land. Positive things in terms of healthcare system is knowing that there are so many people in the community who actually appreciate and care for healthcare workers, and there's that awareness in the struggles that they face every day. But still, I think COVID, with it being for almost over a year now, it's just getting to be very tiresome. And like you were saying, I think it's safe to say that we're all mentally and physically exhausted.
Sam, what would you say to that?
I agree with Kelly. I think one thing we can all take away from COVID is the understanding of how quickly things spread and how to be a little bit more safe in our day-to-day lives. It was the smallest things, which now that I think about it, it's all really just being polite. Keep your distance, cover your mouth when you cough, wash your hands, everything's dirty. So just the littlest things I think that we took for granted before, not doing those, can really, really affect people.
Those are really good points, Sam, and it actually leads nicely into my next question. Would you say you have noticed in the last year a more positive, preventative, pro-health approach in your social circles, friends, family, or the general public? Are people getting it? Is it becoming ingrained in our lifestyles to keep your distance from people and wash your hands more frequently? Or are we all still just doing it because of the pandemic and we're waiting for it to go back to normal where you can go handle the produce in the grocery store without a second thought? Are people becoming more proactive with living a healthier lifestyle?
I personally think people are. I think overall people really are getting it. They are making those conscious efforts. They are coming home from, being out at the grocery store, and they come home and they wash their hands when they get into the house. They disinfect things a little bit more. I think it's just caring a little bit more. I think this has made people aware how little we can do in order to keep ourselves healthy and safe and not spread germs. Although I do also feel that with COVID and the pandemic, there's a lot of uncertainty. There's a lot of disbelief. There is a lot of people who are still really, really scared. I think it really affects how people feel in a negative sense as well. I know with the lack of trust, with the fear, I think it has also caused a lot of people to lose trust within the healthcare system and almost, in a sense, not believe what's going on because of fear.
Okay, Kelly, I'll throw the same question at you. Have you noticed over the last year people becoming more pro-health, preventative, taking measures to take responsibility for their own health, or are we all just still doing it because of the pandemic?
I think this is a tough question to just put a either yes or no on it. I think it depends. It depends on the population. Like Sam was saying, I've definitely seen some people actually becoming more proactive, becoming more educated with how we're supposed to clean things and, keeping that distance if you're sick, wearing masks and different things like that. However, I do feel like some people see these regulations or these protocols as more of an obligation that they have to do because there is a pandemic. So without a doubt, I do feel like after this whole thing is over, and hopefully it will be over soon, there are definitely people who will continue going back to how they've been doing things before the pandemic has started.
I think that's probably correct. A lifetime of doing things one way and then suddenly you're told to do it another way. It can be hard to break lifelong habits. especially if things have always been fine up to that point, more or less. Hopefully one positive, well, I shouldn't say side effect, but outcome of this situation will be a higher percentage of the population, watching what they eat, getting more exercise, being more health conscious. I mean, we've spoken at length this season on A Sound Constitution about health literacy and really taking responsibility for getting credible information about health and wellness and reaching out for resources and supports and doing what you can to take care of yourself. I mean, we keep, the catchphrase for this whole thing has been, we're all in this together. But at the same time, people do have to take responsibility for themselves. Keep yourself healthy. I know the three of us as aspiring nurses, it's on us to make sure that we are 110% before we ever enter a clinical practice setting. I believe nurses have traditionally been pretty good about, calling in sick rather than going to work sick. And I'm sure that has been amplified tenfold since about this time last year. I can speak for myself, coming from a blue collar kind of factory worker background prior to entering nursing school. Calling in sick was often seen as a sign of weakness. A lot of people would just go to work when, they had a sniffle or a cough or, quite often something worse. So I'm thinking one other positive outcome of this pandemic might be that people will think a bit more before going to work sick or going to the grocery store sick. So hopefully we see more of a shift towards that preventative health promotion that I was speaking about, rather than just waving off any sign of illness and going about your day-to-day business as you would normally. As I said earlier, we are third-year Bachelor of Science in Nursing students, and, this time next year, we'll be a month away from graduating and looking at heading into the healthcare workforce ourselves. Kelly, do you have any bold, grandiose, totally speculative predictions for how we might see our healthcare systems change in, let's say, the next 5 years, the world that we are entering as professionals?
I really hope there would be more appreciation and more understanding of sick days, as you were saying, and especially not just physically being sick, mentally being exhausted also count as well. People to recognize that if they're not in a state where they can perform 100% when caring for others, they should not be going into work. And just being able to realize the importance of that would definitely be a change that I wish to see in the healthcare field. And I think with COVID, there is that awareness of the importance of fitness to practice.
Sam, did you have any bold speculative predictions for what the healthcare field is going to look like over the next 5 years for us bright young nurses coming in?
I definitely think in the factor of mental health, I think that will be a lot more incorporated within our jobs for us with our fitness to practice, like Kelly mentioned, but also making that a bigger focus in our patients and clients as they come along as well. We've seen with COVID that people's mental health can be affected so quickly. And I think that will just be a larger focus within our healthcare systems. I also think that with the big influx of younger nurses coming into the healthcare workforce, I think we'll see some more innovative and interesting changes to come along with the new bright minds that are coming in there.
Absolutely. For myself, I think we're going to see an even higher focus on telehealth. Things like the TELUS Babylon app, where you can see a doctor virtually rather than having to go to a clinic or wait until you land in emergency. We had been learning quite a bit about that before the pandemic started, and it was kind of being touted as the wave of the future. And I think we'll see even more of that because we've seen quite a shift in the last year, just people being able to see doctors virtually rather than having to go out and seek one out. And we've all heard the stories about how difficult it can be to find a doctor in Canada or British Columbia or even right here in Nanaimo. So hopefully technology like that continues to advance and alleviates some of those wait times and shortages. So my name is Max. I've been talking here with my co-host Kelly and our research assistant Sam about COVID fatigue and how it's been affecting us as third-year Bachelor of Science in Nursing students. I managed to round up, virtually of course, a few of our classmates in the BSN program at Vancouver Island University and posed many of the same questions to them. How are you holding up a year into the pandemic? What supports have you found useful in this last year? And have you been able to identify any supports you think might still benefit the community that could be implemented at either a government or institutional level to better support you as a student or a future nurse? So we are going to shift to that segment now, right here on A Sound Constitution on CHLY 101.7 FM from Nanaimo.
A year into the pandemic, I'm tired, but still optimistic. I feel like there's a little bit of a light at the end of the tunnel with vaccines coming out and the news that maybe we might be able to go back to class. Something that has been really helpful for me, and I'm really lucky just because of where we live, is being able to get outside. And even seeing people at a safe distance when that was allowed in outside activities has been a savior for me. Something that could be improved upon just from a school standpoint. I think the understanding that we don't want to have our cameras on, having our cameras on doesn't help us. And yeah, assigning less busy work, I guess. It feels like when we went online, we had a lot more to do and less learning. So it's been really challenging.
I completely agree about the busy work. How am I doing a year into the pandemic? I feel like it has so many ups and downs. There are times where the weather is great, getting outside a lot, getting lots of sunshine and exercise. And then there's times where there's days on end that I don't leave the house. And so, yeah, definitely lots of ups and downs. I agree that in our course, less busy work, more just like actual learning. Figuring out how to keep us engaged, even without having to have our screens on. I almost feel guilty not having my screen on because I value that face-to-face so much when we're in person, but then it's just so different online. And I also think just having more like time off, I want to say, like I've really valued having a day off every week, and it's been really challenging, but trying to allow myself to have a day off, not try to be productive on every single day. Because I feel like with school online, I feel like I need to be productive every single day of the week.
So 1 year into the pandemic, I find that I'm quite exhausted. I'm a really social person, so being limited to basically your household is very challenging. I also find it puts additional stress on relationships because now you're expecting that person to not only be your like partner, but to also be your one and only best friend. So if you're someone like me who needs a lot of like attention and interactions with people, and you have more of an introverted partner, that can be like very challenging on both parties as well. I would like to see, or I'm feeling a little bit more hopeful because I do see that they made the rules, Bonnie Henry made the rules the other day. So you are allowed to have small group outdoor gatherings up to 10 people now. And with the vaccines coming out, that seems like steps in the right direction. And there's lots of ways to buy like screen houses or anything creative to kind of make it so you can do it more or less regardless of the weather, especially in BC where we don't get really heavy -20 type temperatures. And I think that at this point, it would be super beneficial to have public health start talking more on a health promotion perspective. So talking more about how we can safely interact with people instead of doing the nope, do not hang out with anyone. It's like the abstinence approach. So people just start breaking the rules and then they don't have the appropriate guidelines to make those decisions with the appropriate kind of risk benefit analysis in place.
So for me, a year into the pandemic, I know it's been a pretty big struggle. I know someone else talked about how difficult it's been, especially for extroverts. I know for me personally, who identifies more as an introvert, I've really noticed how much of a strain it has been on me, even as someone who tends to really value alone time. I guess my only saving grace has been having family close by that I've been able to keep in contact with and see from time to time. If it weren't for that, like I'd be pretty at my wit's end. Hearing that we may be able to return to online classes in the fall is going to be a big thing. I know one of the worst things for me has been the lack of a schedule, and a lot of classes kind of being pushed back into afternoons. For me, it's been difficult to kind of keep my time managed effectively. It's really thrown off things like my sleep schedule and just trying to keep a regular routine. So I'm looking forward to things going back to normal and having a more well-established routine set up.
Definitely, this adaptation to the pandemic has had its challenges. I do technically identify myself as being more of an introvert, so I don't mind kind of being at home and working from home. But there are kind of things that I've had to shift, especially myself. I suffer from sleep apnea, so I'm already sensitive to fatigue to begin with. So I've had to be really kind of cognizant about my changes in my life. So I mean, if you're able to, I know there's, you can either buy versions of sit-to-stand desks, or you could find 2 different surfaces in your house, and whether you have books, but it's really good to switch up and kind of, you don't want to be in the same position for long periods of time. So standing all day isn't going to be any better, but switching maybe an hour sitting to an hour standing while doing your work or classes, if you're able to. Another couple tips that I can think of quickly sharing, 4-7-8 breathing. So this can be helpful with decreasing anxiety. It can help with sleep, cravings, and just help your focus. So this will be breathing in for 4 seconds, holding your breath for 7 seconds, and then breathing out for 8 seconds. And another thing, we're always staring at the screens, and that tires me out really quickly. So I've been trying to kind of implement the 20-20-20 rule. So what you do with this is every time you're looking at the screen for 20 minutes, you're going to look at something 20 feet away for around 20 seconds and just repeat that process throughout the day. And hopefully those can help kind of increase your focus and decrease the fatigue.
So a year into COVID, the COVID fatigue is definitely real. It's definitely hitting. I'm kind of definitely sick of being cooped up. As an extrovert, this has definitely been one of those times where I got to wake up every day and just reassure myself that everything's going to be okay, and just that I'm enough, basically. That's like the biggest thing right now that I'm trying to work on, is that, you know, we just got to take these things one day at a time. We put ourselves through so much unnecessary misery, thinking about the future and just anything, guilting ourselves about not getting enough stuff done during this pandemic. Like, just keep that in mind. That's what I've been trying to do, is step 1, keep going, keep trying, take it step by step, day by day. Just by being aware of what we're going through, it makes it a little bit easier on yourself. So that's what I've been trying to do. Exercise as well. That's a huge one for me that I've been trying to do. I found during like the first 3 to 6 months of COVID, all of my physical activity kind of fell through the floor, because soccer stopped, intramural stopped, all these things stopped. And I kind of was left sitting around like, oh, I have to force myself now to do exercise instead of it just randomly falling into my lap. So that's kind of what I've been doing, and just talking with people. That's also a good one. Like, if you're not connecting with people, reach out. That's the best way we can kind of stay on the same page, not feel so isolated. We'll get through this together. Even though it may seem grim, we got this.
As we reach the end of today's episode, we're also reaching the end of our first season as your hosts here on A Sound Constitution. Our group has had a great time putting the show together for our listeners, and we've learned a lot along the way. I asked my co-hosts and our instructor if they wouldn't mind saying a few words about their experience over the past few weeks putting the show together, and they were kind enough to oblige me, so let's have a listen.
My name is Sandy Alexander, and I have to say I'm the very lucky nursing professor who gets to work with the nursing students as they produce A Sound Constitution this season. I just thought I'd start off also by just sharing a little interesting history nugget about A Sound Constitution with our listeners today. A Sound Constitution really came to be because it was a student-driven health promotion initiative. Way back in 2009, another faculty member and I were approached about this potential project, and along with CHLY, we wanted to really support. We thought it was a great idea that students produce a health promotion radio show that really works to try to build capacity in relation to addressing and enhancing the health literacy needs of our community. A Sound Constitution launched its first season way back in 2010, and I can't believe that it's already been 11 years. So it really, over the years, it's been truly a privilege to work with such exceptional and creative nursing students, including our current host this season. Our listeners may not know that our nursing students really put in countless hours to produce a highly credible health information program to really address what's relevant and trending in terms of health and wellness needs and issues. Another thing that A Sound Constitution works really hard to provide are community resources to help build on the health needs and wellness needs of our community. One of the missions of our program has been really to demystify health information by separating fact from fiction, which, if we recall from the health literacy show that was produced by Harris and Kelly and Max, there is a lot of misinformation out there from various sources, and sometimes it is really hard to decipher what is credible and what is non-credible health information. I also want to highlight another maybe interesting fact about A Sound Constitution, and that A Sound Constitution continues to be the only nursing student-led health promotion radio show in North America. So in saying that, I really want to thank those that have helped us continue with this program. And so a big shout out to Arby Frew and Jesse Woodward and all the team at CHLY for their ongoing support and guidance that you've provided ourselves and our nursing students over the years. In closing, I just want to commend our current BSN students again for their amazing work this season, and just to say that it's been truly a pleasure working with you, and I look forward to our next season together.
I really have appreciated working and listening to all of my co-students who have brought forward some of the ideas that they are most passionate about, been able to explore this with you and ask some really thought-provoking questions that have actually changed me and changed my worldview. I'm really excited to come back in the fall and continue some of our conversations. There's still so much to know, and I really look forward to continuing to have amazing interviews. Thank you to Matt Potter, who was my interview from Paramedics, episode 2. Thank you also to Arby Frew, and a very warm thank you to our professor, Sandy Alexander, for giving us awesome guidance and integrating health and healing topics throughout our episodes.
Thank you, everyone, for an amazing time working with A Sound Constitution on top of a relatively difficult year for me. Thank you to all my interviewees, my instructor, and my peers for supporting me throughout this semester. I have learned a lot about health literacy, mental health, homelessness, working with the Indigenous population, and many other topics. It's been a wonderful time, and I look forward to coming back next semester.
Samantha here. Thank you so much for tuning in and joining us this season. There's been a lot of learning and a lot of teaching on everybody's part, and it's been such a great time to be here with you guys. Cannot wait to be back next season. Thank you so much.
Hey, it's Harris here from A Sound Constitution. I just want to thank you all for a great season. We've learned a lot of great things over the course of the show, touched on a lot of interesting topics. I look forward to joining you all next semester.
A season wrap up on A Sound Constitution already. Wow, how time flies. It has been so much fun collaborating, learning, and growing with the community around us, especially collaborating with my team members in the BSN program. It's been super fun producing radio shows and working with our field guide on CHLY. It's actually been such a fun community practice placement, and I've learned so much about community health. So I'm super excited about next season, and I'm looking forward to working with everyone again on producing more content on CHLY 101.7 FM radio.
On behalf of the entire team here at A Sound Constitution, I'd like to say thank you very much to our instructor Sandy, our field guide at CHLY Arby, and all of you for tuning in each week as we have sought to demystify health issues in our community. As always, we welcome your feedback on today's episode or any other, and we encourage you to reach out to us through email at asoundconstitution@gmail.com or through our Facebook, YouTube, or Instagram pages. It's been a great season, and we will see you back next fall with all new episodes. Have a great summer, and thank you very much for tuning in. This is Max, signing off, A Sound Constitution, CHLY 101.7 FM from Nanaimo.